Hello everyone, this is Dr. Rich from Salvatore Dental. Today we'll be discussing the differences between mini implants and full implants. A lot of patients want something that's fast and cheap and easy, but I got some news for you. It's not always fast, cheap, and easy. So here we go. What are dental implants and how do they work? So a dental implant is a replacement for a tooth. Basically, a dental implant is a titanium foundation that we can put a single tooth on, or in other situations, we can put a bridge, or we can have it be all of your teeth, or it can be even like a denture that snaps on and off. So a dental implant is a way for us to replace teeth that have been missing, that it's a permanent option, unlike something that is removable and comes in and out. We often hear what is the difference between mini dental implants and full or regular dental implants. There's quite a big difference. So it's basically in the term. So a mini implant is very, very small compared to a large implant. So a mini implant, the way that I like to tell patients, it's almost like a thumbtack. And the funny way to say this is, and it might be a little bit weird to hear, our bone in our mouth is it's a little bit porous and it's almost like drywall. So if you've ever dealt with drywall, it's hard, but it's not super hard. So you can take a thumbtack and you can stick it in a drywall and it'll stay. So I always tell my patients a mini implant's kind of like a thumbtack, while a regular implant is more like a bigger lag bolt. And if you want to hang a picture that has any kind of heft to it, would you rather use a thumbtack or would you rather use a big, nice lag bolt? It might be a kind of a crazy thing to talk about when we're talking about, implants and placing them in our mouth, but it's a very similar concept. So mini implants are much smaller, they're narrow, there's not as much surface area for the bone to bond to, so they're much less stable than regular implants. And a regular implant is much larger, there's more stability, there's more options to restore, more options to put different kind of connectors on top of a regular implant. Well, a mini implant only has one connector and really limits the option. The crazy thing is mini implants actually came about to be temporary implants. So first they weren't called mini implants, they're called temporary implants. A long time ago, we would place implants, regular implants in, and the theory back then is that you can't put any weight on the implant. So what we do is we put regular implants in, we would hibernate those, bury those, you don't touch them. And then we take these temporary implants that are now mini implants and we place them in other areas and we put teeth on top of those. And after about 3 months, everything would be healed with your normal implants, and then we'd take out the mini or temporary implants. Some dentists found that some of those temporary implants were kind of difficult to get out, and they had the idea of, hey, maybe we can actually use these because they're kind of stable. They're cheaper, faster, less painful, but ultimately they're not very stable. So that's kind of the differences between mini implants and regular implants. Patients ask, are mini implants a reliable option for tooth replacement? I'd hate to say this and I hate to break the bad news, but in our practice, they honestly are not a great option. I've personally taken out hundreds of mini implants, and most of the time I can unscrew them with my fingers. So that kind of shows you that they don't really integrate or bond well with the bone. So they're not very reliable. They started off as temporary implants, and that's kind of where my vision stays with them. There are people who do a lot of things that with mini implants that are a little bit outside of the box, but here at Salvatore Dental, we want to do things the right way. We want to make sure that if you're investing in implants, that they're going to be strong and stable, and it's not going to be any kind of temporary or unreliable solution. The question about time and money always comes up. So patients come in, they say, well, why do mini implants cost less than full implants? And can we save a little bit of money by doing this mini implant? The reason why mini implants cost less is because they're honestly a little easier to do, and they're cheaper for us to buy, because a mini implant is a very small implant. It's one piece, there's not multiple pieces to it. While a regular implant is bigger, costs more money, and there's all different pieces that connect to it. So a mini implant is one piece, while a regular implant may be 2 or 3 pieces. So that's one reason why it's less expensive. Another reason why people tend to like mini implants is that it's more non-invasive, meaning that with regular implants, sometimes we have to do a big surgery where we have to get you numb. Sounds kind of gross. We had to kind of open the tissue up, place the implant, and close the tissue again. The techniques that some people use with mini implants is they don't open the tissue at all. They just kind of go right through the gum into the bone. A couple of reasons why I don't like that. You're kind of going blind. You're not exactly sure what you're going for. A lot of times the mini implants, the reason why people use them is because there's not much bone, and now you're trying to go through the tissue and go to the bone without even seeing it. So there's a lot of reasons why they're unreliable in my view, and the reason why they're cheaper is that they're supposed to be faster and easier, but at Salvatore Dental we do things right, and we'll make sure I'm not going to give you a mini implant. So what are the long-term risks of choosing a mini implant over a regular implant? The long-term risk would honestly be failure. which is a word that we don't like, especially when we're talking about surgery or a lot of time and money in the office. You're getting numb, you're having surgery, you're healing, and we do not want to have any kind of failure either within the first 2 to 3 months or years in the future. And that's what happens a lot of times with mini implants. They might look good or feel good the first year or two, but then after that, they start to fail and things go down. Many reasons why that happens. Mini implants are very tiny and small and they're skinny. A mini implant has to be less than 3 millimeters, while full implant is 3 to 6 millimeters. So there's just a lot skinnier, and they're one piece. So the day the mini implant goes in, it's in your mouth and you're functioning and biting on it. So there's no time for that to heal. That's one of the reasons why it doesn't integrate or bond to the bone. Another reason is that they're just not as strong. I've seen mini implants break. There's many issues that I see. So I always want to tell my patients that you got to do it the right way. We don't save money on certain things. We can save money, coupons in other places, but whenever you go to, I'm not a tattoo guy, but if you get a tattoo, if you get, healthcare, if you're going to go skydiving, or if you're going to get implants, you want to pay the right price and make sure that you're getting full quality. Patients ask, why are mini implants more prone to failure? It's honestly just the structure of the mini implant. Very skinny, very thin. They're meant to be temporary implants, and then they changed the name from temporary to mini because some people started using them for non-temporary purposes. They're one piece, which sounds great because you have the implant and then you have the portion that's above the gum where you hook the tooth onto. The problem with it being one piece is when you put it in, now you've got a piece that's exposed in your mouth. And usually with implants, we place the implant, we give it good time to heal, and then we put pressure on it. With a mini implant, we don't give it a lot of time to heal. So anytime you're biting or chewing, and if you hit that implant or the abutment on the implant, it's gonna move and it's not gonna integrate or work. And that's a couple reasons why mini implants are more prone to failure. Patients ask, who's the ideal candidate for mini implants and when should they be avoided? The only time that I can see it possible for mini implant is when there's no other options. Some patients have lost teeth, especially in the lower, for years and years, maybe it's been 30 years with a lower denture. There's a lot of recession and the denture just does not fit at all. And honestly, there's not much bone at all. So in those cases, we can place mini implants because there's just no other options. And that's really the only spot where I can see it. We're gonna put 2 in the bottom bone is strong enough where hopefully that mini implant's gonna hold. And just telling the patient up front that, this could work or it might not. If it works, amazing. If it doesn't, then we're just back in the denture. So what are the benefits of investing in a full dental implant compared to a mini dental implant? The benefits are just knowing that it's gonna work. We have multiple ways that we restore teeth, and with full dental implants, I know there's gonna be stability of that tooth, that implant long-term, and then we can have a custom abutment or a custom piece that comes out of the gum, so we know that the crown or the restoration or the bridge that we're gonna use is gonna fit perfectly and look really nice. So the benefit of full dental implants is just knowing that it's gonna work, it's gonna look great, and it's gonna feel like your natural tooth. So patients always ask, how long are full dental implants gonna last, and how long are they gonna last compared to mini implants? So full dental implants, all the studies now show about 98% success rate over 10 years. So if we have 100 implants, only 2 of those are gonna have issues within those first 10 years. So that's a really good statistic, especially in dentistry. Mini implants, it's maybe, I hate to say, but it's maybe half of that if we're lucky. I personally have seen more failures of mini implants than success stories of mini implants. So here at Salvatore Dental, we really shy away from mini implants. We do everything we can to make sure there's enough bone, and we have different techniques to get the implant in an area where we can use a full implant that's gonna be strong and stable long-term. So some advice I'd give to patients considering mini implants due to lower cost, I would say you really just have to invest in a full implant. Mini implants, they sound great, very good for marketing, they're cheap, they're fast, they're easy, but honestly, they are not super long-term. I would say either wait a little longer to be able to afford a full-size implant or a regular implant, or we have options here at Salvatore Dental where we can finance over time. We have some financing options up to 10 years, so we can kind of put to the side some of the financial stress, and we're able to get the correct full implant to our patients where we know it's gonna be long-lasting and stable. So if you guys are interested in implants or have any questions or concerns about tooth loss and how to replace things, even if it's been 30 years with no teeth, you would be amazed at the things we can do now with dental implants. So any questions, please give us a call. We'd love to meet you. We've got a free consult for implants. Our phone number is 518-899-6068, and it's salvatoredental.com.